Hello, everybody, and welcome to Pull Up with Limbs and Things. This episode, we're talking about some of the things that we are trying to find out. Is this normal as we age, or is this something that I should probably do something about? So, as we get older, sometimes we may feel like we just can't hold it, got to get to the bathroom right away. Or you find that, you know, maybe I'm drinking too much at the end of the day, or I'm finding that I'm unable to laugh and cough and do those things without having a little bit of leakage. And so we have Dr. Tieya Qualls, and she is going to talk to us a little bit about those things and to answer any other specific questions that come up during our discussion. So we invite you to listen, pay attention. If you have questions, please ask them. Welcome, Dr. Qualls. How are you?
I'm doing pretty good. Thank you for having me.
Absolutely. So, pull up with limbs and things is to confirm something you know, challenge something you don't know, and give you the opportunity to share that with somebody else. Tell us a little bit about quality touch.
Okay, so yes, as Dr. James said, my name is Dr. Tieya Qualls, and I'm the owner of Quality Touch Physical Therapy and Wellness. And my company is a mobile company here in the DC, Maryland, and Virginia region. We provide physical therapy services in the comfort of your home. But in addition to that, we also provide services at our Alexandria, Virginia location and our Rockville, Maryland location. And then for those of you all who want a more virtual experience, you also have the option of doing telehealth as well. We provide general PT services for all things aches and pains from head to toe. But we also specialize in the treatment of pelvic floor conditions. And what that is any condition that affects your bowels, your bladder, or your sexual function. It also includes post surgical procedures. So, procedures that impact your reproductive organs, genitals, abdomen. And even though this wouldn't be your audience, Dr. James, we also cover those who are pregnant and postpartum. In
Mm-hmm.
addition to PT, we also offer general wellness screenings and different types of customized fitness plans, as well as birth doula services, birth prep, and postpartum recovery services.
That's a lot.
It is.
That's great, though. There are so many people who are in need of pelvic health. That's what we're talking about tonight, but also from even before somebody is born until they come into earth with all of us. So it's that's great. I'm glad you shared all of the things that you offer. So tell us a little bit about what's normal as we age in the pelvic health realm.
Well, generally speaking, and not just pelvic floor, but specifically to the pelvic floor, we expect that muscle function will change. So that usually looks like we may develop what we call atrophy. That just means muscles may shrink down. They may not be as bulky as they used to be. And they also may not function with regard to strength as much as they did prior to the aging process. So, what that can lead to is that you may find that you may feel feelings of heaviness, and for women or people who identify as female, um, feelings of heaviness in your vagina or your anal area. For those that identify as male, they may feel the same thing, maybe in their rectum, their anal rectal region. In addition to that, you may notice that there are symptoms such as urinary leakage. Some
Mhm.
people may say that, oh, I can't hold it when I get an urge, or if I cough, laugh, or sneeze, I may leak. So
Mhm.
those are some common things. For some, they may also experience fecal changes, meaning that they may not be able to hold their bowels in as much as they used to. Those are the main things that I might see in someone who is one of our older adults.
Okay.
Hmm.
So if the person comes and they say, I think I may need some assistance in this area, what's the route that they should take in order to get the care they need?
Well, generally, when I talk to my clients who are older adults, they may have come through their physician. That's usually the primary method that they get information that that pelvic floor PT even exists.
Hmm.
So generally, they may have gone to their doctor and been like, "Oh, doctor such and such, I am having a hard time holding urine." They may say that.
Hmm.
Generally, this will be primary care or a urologist, sometimes a gynecologist. For those that may have had other issues in their earlier years, particularly for those who identify as female, if they've had any kind of gynecological surgery, it may be a urogynecologist. And
Mm,
so they may say, I'm having a hard time holding in urine. I'm having a hard time with getting urine out for my male clients. They may say
mhm.
that they can't pee as easily as they used to.
Right.
So they may ask for any advice. And that's when sometimes the doctors that are more like likely to refer to a pelvic floor therapist will say, here's a referral for pelvic floor PT. Before that, they may do some tests or just listening to their symptoms, they may give them a prescription for a medication that's appropriate, and it will depend on what they think is appropriate. But
Mm,
for those that are in the know, they may say, oh, you can see a pelvic floor physical therapist. That's one way. Sometimes my clients come because they know that they have these symptoms and they may have Googled something. And then they get that light bulb over the head moment where they say, oh, I need to reach out to this kind of provider. And
mhm.
so generally they'll basically call us up and we'll go through a series of questions and answers and get them scheduled.
Okay.
Hmm.
Is pelvic floor therapy covered by your insurance?
For some, well, actually, for your population, yes. Generally, I would assume you're seeing clients who are of Medicare age. Medicare Part
Hmm.
B is
Yes.
usually cover their 80%. For some companies such as myself, we are out of network with commercial insurances. So what that means is for that 20%, your secondary insurance may or may not cover it.
Right.
On average, most of them will, but we always like to verify your benefits before we get started to let you know. And
Hmm.
then if there's any kind of self-pay or anything like that, then we would work that out with you and let you know what the responsibility would be.
Okay.
Mhm.
That sounds good. Okay, so let's talk about the male um, pelvic floor in terms of how they might age and what signs they should probably look out for,
Mhm.
to know if there's something that they should do something about or something that's considered normal.
Well, the funny thing is, a lot of things that people consider normal, it really is not normal, quote unquote.
Hmm.
Anything that's impacting function or quality of life isn't normal for you. So,
Hmm.
for instance, I have people who think that urinary leakage, oh, it's just a little leakage, or oh, that's supposed to happen because I'm getting older, whether male or female, or those that identify as either. um, they may think that that's normal and it's just not. Anytime you are leaking, that's a risk for infection. Obviously, that's also a falls risk because people may be rushing to the bathroom and may trip or have different kind of balance issues or proprioceptive issues where they don't, feel their feet under them as well as they used to. So we want to make sure that you're not leaking because we don't want to have a domino effect of other issues. So if you're having leakage, whether it's urine or feces, then we want you to get treated for that. The other thing would be if someone is saying that they're having pain in any of these areas, especially if they are still sexually active,
Hmm.
then they shouldn't be having pain with intercourse. For instance, if they're still having penetrative intercourse, there should be no pain. So those are things that you would work with both your physical therapist and your medical provider. There may be things we want to address with you, whether it be lubrication options or different kinds of treatment for the muscles, things like that. And then, in addition to pain, leakage, there may be outlier symptoms like pressure. They may not register it as pain. Some people don't really call things pain because it doesn't feel like excruciating. So they
Right.
may say, oh, I feel pressure in my butt when I feel like I have to go to the bathroom, or I feel like I am feeling pressure in my tummy at times of the day. Those are things that once we rule out the medical part, that there's no medical reason, they may
Hmm.
say, oh, it may be muscular, so you should see a PT. So those types of things are not normal. You should not be experiencing that. For my gentleman who identifies male, we don't want you to be struggling to pee. So you shouldn't have to push your pee out. If you're experiencing that and they ruled out a prostate issue, or they may say, we've already addressed your prostate, they may say, you know what, let's go have you see a pelvic floor PT so they can work with the muscle part of it so they can improve that and help you better.
That's good information, very much so. Okay, so for the person who's watching and listening and wondering how you're going to improve those muscles, is it invasive?
It can be depending on, honestly, I usually do a consultation with my clients and I get a feel for an idea of what they're comfortable with. We
Yes.
don't have a one size fits all approach to evaluating or treatment. So I usually customize it based on what the patient's needs are.
Mm-hmm.
So for those who are open to it, we'll go through a comprehensive evaluation where we would do a series of Q&A. Obviously, we get all the questions that we need about your function. Then we go into an observation assessment. Even though it's pelvic floor, we don't skip out on the observation of the other parts of the body because you're a
Mm-hmm.
whole person. So I may look at your balance. I may look at your mobility when you do certain movements like single leg stance, like squat formation. I'm going to look at your posture because those things play into what's happening at your pelvic floor. I'm going to also want to assess your tissue quality of your tummy, your side flank, your back, and then of course your pelvic floor. For that part, that will be where most of the time, if you're in clinic with me, I'm going to have you lying on a flat surface, usually a treatment table. If you're in home, it'll be on a flat surface in your home, and
Mm-hmm.
then you're covered with a sheet on top of a pad. And then I'm going to observe around the genital region for those who are male, female, non-binary, so forth and so on. It's the same assessment. I'm looking at the genital region. You're covered, of course, but I'm going to have to look under the sheet and look at the tissue. I'm looking for anything that's atypical, if there's anything that's red, swollen, any growths, anything that may seem out of the norm, so that we know to alert a medical provider to address those things.
Mm-hmm.
Then, if none of that is of concern, we're going to palpate that area, which means touch. And I want to feel for your pain response. If you're having pain at all, if there's any issue with sensitivity, and then for most of my clients who are open to it, we'll do an internal vaginal muscle assessment. This isn't like your gynecological exam for those that
Mm-hmm.
identify as female. This is just a finger assessment. I'm touching the muscles with my finger. So I'm going to insert my finger into the vaginal canal and I'm going to touch the musculature to feel how tense it may be, how loose it may feel. I'm going to also assess your strength. So I'm going to have you squeeze. I want to see how well you can also let go because some people can squeeze, but they can't release easily. And then
Mm-hmm.
for some, I'm going to feel how well they push down or bear down. I am going to also want to assess for signs of prolapse. That means that prolapse just means that the support structures that used to provide a lot of stability, they aren't giving as much. So they may allow some things to sag down. So we want to assess for that. For those that identify as male, I will do the same external assessment around the genital region, the penis, the scrotum, perineum, that's the space between the scrotum and the anus, and then the anal area from the outside. But then for those that are open to it, I may do an internal rectal assessment where I'm going to insert my finger through the anus into the rectal tissue to feel the musculature. Now, with all of that said, those are, standards of care, but that doesn't have to occur for every single person if they're not comfortable. I've had people who say they're not comfortable with certain elements, whether male, female, or other, and I don't do those portions. I do what I can. We can get a lot of information from an external only assessment and do really good treatment with those things. Now, for some people who I find that I may need a little bit more information, I'll give them my assessment, my honest assessment, and say, you may benefit from this, but I totally understand if you're not comfortable with it, and we'll do the best that we can within the parameters that we have.
That was very thorough. I agree. They are definitely people who you have to determine which is more comfortable for them.
Yeah.
Um, because we're all different and we just got to feel comfortable with getting the care that we need. But
Mhm.
that's great.
Yeah.
So, if you are interested in contacting you, how should we get in touch with you?
You can reach out to us in a few different ways. You can always go to our website. Website is www.qualitytouchpt.com. And there you can sign up for a free virtual consultation, 15 minutes, and we can chat over the web and get some information there. Or you can reach out to us via email at info@qualitytouchpt.com. And then some people can go ahead and give us a call at 301-246-2353. Oh,
Absolutely.
and one more way, you can also check us out on all social media platforms at Quality Touch PT.
Awesome. Okay. So, I have a few more questions.
Sure, go right ahead.
I want to know how you got into pelvic
Mm.
health. Why?
Um,
What drew you?
I didn't know about specifically about pelvic floor PT
Mhm.
until I was in grad school for physical therapy. We had a lecture by some local pelvic floor physical therapists, and that's when I was like, "Oh, this is a whole path." And at the time, the the specialty was called women's health. They didn't even
Right.
really factor in male's health, but it
Mm-hmm.
was called women's health. So now it's just pelvic floor. So basically, at that time, they did a demonstration on some interventions that you can do for pelvic floor conditions. They also lectured us on different types of pelvic floor conditions, and it just really sparked my interest. And from there, I, just kind of started to do more research and get more information about it. And that's just where, how my career kind of flowed. In the
Mm-hmm.
beginning, it was a little hard finding places that even offered pelvic floor PT because it
Right.
wasn't as prevalent as it is now. But
Right.
eventually,
There's so many of you guys now.
yeah, it's much better than it used to be when I first
Yes,
started. But then
absolutely.
eventually, I worked at a hospital system that offered pelvic floor PT. I started treating and learning things from the people who I was working with, as well as taking more continuing education. And
Mhm.
then, that kind of transitioned into where I am now.
Awesome.
Mhm.
Okay, so there are a lot of people who are advertising as well as what's the best word? Suggesting
Yeah.
that you use or do Kegels.
Okay.
Let's hear your thoughts on that.
Though, first of all, the word Kegel is just a person's last name.
Hmm.
It was a male that I guess coined the phrase based on him identifying that you could do this. I'm not sure of the history, but we know it was just a person's last name. So we're trying to really steer clear of that name Kegels and go more with pelvic floor muscle contraction. It's a little
Okay.
longer, but it's more appropriate. So with that, Kegels have their place. They have their place, but I generally find that you're not going to do one type of intervention with the client. For those that who are, for instance, quote unquote weak in their pelvic floor, or they may leak, they may assume, oh, I need to do these squeezes. I need to squeeze my pelvic floor because
Mhm.
that's what an article told them or someone online.
Right.
But generally, it's not a one size fit all. I often find that I do a combination of a variety of things. I may do hands-on treatment to release tight muscles. So that may require you to release something that's tight. If you're squeezing something that's already tight, you're kind of making the problem worse. So I will tell people, you don't have to keep doing all these Kegels. We need to release a little bit. We may need to do that first before we even start doing a dedicated isolated strengthening program for the pelvic floor. But in addition to that, let's say the person is appropriate for some type of strengthening. It's very rare that it's going to be just the Kegel itself. It's usually going to involve hip strengthening and core strengthening because those systems work with the pelvic floor directly in simultaneously. So we have to strengthen that whole system. Otherwise, the person may not see the gains that they're trying to improve on.
Mm-hmm.
So I will say it has its place, but I always recommend that people get an assessment first. Get a pelvic floor assessment screening first to figure out if it's even appropriate for you, and then let your physical therapist guide you through that plan of care.
Absolutely. That's great advice. Another question, this is probably more of a specific one.
Okay.
I've had patients who say, well, I haven't had sex in a long time, and
Hmm.
I feel like my hips are not as mobile as they were previously, and thinking that sex is the only way that your flexibility remains.
Hmm.
What would you say is something that they can do? And is it really necessary to see a pelvic floor PT for that? Or would it just be that there's something else you should do?
You know, I see clients all the time related to sex related issues, whether it's pain, whether it's, improving orgasmic function, things like that. So it's a variety of reasons. But all in all, when it comes to mobility, I definitely think that again, if you're having discomfort with positioning during sex, whether it's like you can't tolerate positions you used to, or you are feeling like penetration is very painful, or even touch may be sensitive, whatever the case may be, I think you could benefit from a pelvic floor evaluation and possibly treatment. Now, to start, I can't guide you all individually because I'm not your pelvic floor physical therapist, but you may just want to become more active. That means you may start doing general mobility things to get your body more accustomed to your ranges of motion, but you want to do that safely. You don't want to just go gung-ho and you've been sedentary all this time and then all of a sudden you try to do a spin class that you never did before, or you try to do a yoga class or tai chi or whatever. You want
Yeah.
to work your way up to things, but
Mhm.
again, I think it will be best under the guidance of a trained professional so that you don't get injured. especially for our population, our aging population, we want to make sure that you don't have a tear or a fracture or different things like that. So, with that said, I do think improving your general mobility, even before you are getting back into intercourse, would be great because then when you are ready to resume activity, then you have your body has already started to begin to unwind some of those tight spots, or you've gotten stronger because it's not just about lengthening tissue. We have to strengthen because, as we know, intercourse is a physical activity. You have to assume certain positions for lengths of time. If you haven't been doing certain movements or certain positions and postures for a long time, you're going to fatigue out, and that may not be enjoyable for you or your partner.
Right.
Hmm.
Absolutely.
Hmm.
But that's great. I am glad that you shared that information. I shared it from my point of view, but you
Hmm.
did a much better job.
Okay.
So, if there are any final thoughts, anything I didn't ask that you want to make sure an aging adult might know about their pelvic floor, please share.
Oh yeah, definitely. I always, for my aging population, I always just let people know, don't be afraid to ask questions when you see your providers, your
Mhm.
medical providers, because those will probably be your first lines of defense. Come with your questions about your pelvic floor, meaning like anything related to your bowels, your bladder, or your sexual function. Come with the questions written out so that you don't get, so that you don't forget or it doesn't get rushed through, and then it can help guide you better. But also, don't be afraid to reach out to a physical therapist, a pelvic floor PT on your own, and
Mhm.
allow them to maybe educate you on some things. Like I said, we offer free virtual consultations. I'm more than happy to chat. So if you have that option, feel free to ask as many questions so you can get a better understanding, so that you're not suffering in silence. Because that's what I find that a lot of people are doing. They are thinking, "Oh, I'm going to leak forever," or "This is
Well,
normal."
it is normal, right? Right.
So they end up never seeking out treatment. And I don't ever promise anyone, miracles, but I do think that most things can be improved upon. So I would just say don't suffer in silence, reach out, ask questions.
Absolutely. Well, I want to thank you so much for your time. If you all have any questions about pelvic health, if you have any questions about bowel, bladder, or sexual health, is that right?
Hmm.
And you should contact Quality Touch Physical Therapy. Tell us the areas that you service again.
So we treat in DC, Maryland, and Virginia. So you have the option of having us at your home. You can come visit us in the clinics that we have in Rockville or Alexandria. And then we can do telehealth visits as well.
Absolutely. Well, thank you so much, everybody. I hope you have a great evening and
Thank
that
you.
this information was helpful. Thank you. Bye.